Hi, my name is Joe Boyd. I'm the Global Head of Sales and Marketing with Avellino. I'm excited to join the American Academy of Optometry today to talk about Avogen, the genetic eye test. Avogen is there to better help us understand the risk of keratoconus. And we're most interested in keratoconus because we know that the impact it has on patients' daily activities, such as reading and driving, as well as the doctor's ability to keep these patients corrected and in contact lenses. Ultimately, left untreated, keratoconus could create permanent vision loss. Everyone knows and understands what is happening with keratoconus in the eye care community, but oftentimes the patients may not understand that these changes lead to that progression in the protruding of the cornea, as seen on the right-hand side. Keratoconus is prevalent, but often difficult to diagnose. We know today there's about 600,000 patients in the US market, but most importantly, there's about 3.6 million adults at risk in North America. This creates frequent changes in their spectacles, and these are often overlooked as the progression continues to occur. Even with the advancement in imaging and the ability to treat some of these patients, we know that 1 out of 5 people with keratoconus will ultimately need a corneal transplant. That's why it's important for us to better identify these patients in their teen years, often when the disease starts to progress. And Avogen is a test that will help us do that. It is the first genetic test that provides eye care providers the information to help them quantify the risk of keratoconus and even the presence of corneal dystrophies. So how does Avogen work in the clinical practice? Let's take a look at the impact of a family history. Here we have a patient who has been cross-linked, which is oftentimes one that may be seen in an optometrist practice. You can see on this image that the patient in the right eye has advanced keratoconus. In fact, this patient was actually cross-linked. And you'll notice that the imaging on the left eye shows us that there are risks and concerns that we'd want to continue to follow for the patient. But as any parent might want to know is, what about their children? And this is the question that came up with this mom, is should her 8-year-old son be tested? Well, when we looked at the images, what we can see here is today the patient is able to be corrected to 20/20. However, in this 8-year-old, you can see that there are some subtle signs that there are some changes in visions that are starting to occur. On the right-hand side, we can see a truncated bow tie, and we can start seeing on the left-hand side that this image is starting to show us that the patient has an oblique astigmatism. So today we would watch this patient, but what can Avogen tell us? And when we take a look at Avogen, we now can understand the genetic risk associated with the imaging that the doctor was able to provide, which helps us better understand that this patient has an increased risk above the normal population. We'd want to continue monitoring this patient and looking at even more subtle signs of progression so that we can help move this patient to the right type of lenses that they might need, or potentially even corneal cross-linking. So thank you. We really appreciate the opportunity to work with Optometry. We're excited that we're able to bring Avogen, the genetic eye test, to you, and we look forward to working closely with you in the future. Thank you very much.